Does a massive study of V-safe data collected by the Centers for Disease Control and Prevention (CDC) prove that the COVID-19 vaccine caused a stunning amount of severe side effects? No, that's not true. No such study occurred, and no reputable scientific or medical institution has published a wide-scale study to establish causation between vaccination and self-reported vaccine adverse events collected by the CDC's voluntary V-Safe smartphone program. The claim originated in an Instagram post on October 8, 2022, by the Florida Standard that claimed over 700,000 of vaccinated in massive study forced to seek medical care for severe side effects. The post read, quote, "After a lawsuit against the CDC, the Informed Consent Network has compiled the raw data from the V-Safe vaccine monitoring app. The results show a remarkable amount of severe side effects. Link in bio." End quote. This is how the post appeared on Instagram at the time of this writing. Source: Instagram screenshot taken on Tuesday, October 11, 21 hours 32 minutes and 36 seconds 2022 UTC. The link in the Instagram bio directed users to an article published on the website The Florida Standard on October 7, 2022. In it, the author described a study conducted by the anti-vaccine group Informed Consent Action Network, ICAN. However, the ICAN data did not reflect a reputable, peer-reviewed study. Rather, it reflected a dashboard created to display what was said to be V-safe data compiled by the CDC. While the existence of such reports may be authentic, they do not establish a causation between the vaccine and reported health outcomes. What is V-safe? V-safe is an active surveillance program implemented by the CDC and Food and Drug Administration (FDA) after COVID vaccines were rolled out. The smartphone-based program is used to monitor safety following vaccinations, and does so by periodically sending text message reminders to people enrolled in the program to enter health information as a means to identify possible adverse events following immunization. V-safe reports do not equate causation like the Vaccine Adverse Event Reporting System (VAERS). V-safe is a self-reporting mechanism limited in its scope as it relies solely on individuals reporting their experiences, which have not been verified by medical professionals, notes the CDC website. Symptoms reported in the V-safe system do not indicate that they were caused by a vaccine, reports the College of Physicians of Philadelphia nonprofit organization History of Vaccines. That's not to say that such events didn't happen, but that they have not been evaluated by experts to determine causation between vaccine administration and a reported side effect. More likely to report adverse health outcomes. The Florida Standard article suggested that a large number of vaccine recipients reported severe health outcomes after being vaccinated. Quote, 7.7% or 782,913 individuals experienced such severe adverse events that they had to seek medical care, ended up in the emergency room and/or were hospitalized. What's remarkable is also that these participants experienced a stunning amount of side effects. Over 71 million symptoms were reported. Out of those, the most common were pain, fatigue and headaches. Over 4 million symptoms were reported as severe. End quote. The article concluded, quote, "The V-safe program only included less than 4% of people that received a COVID-19 vaccine." End quote. According to the Department of Health and Human Services, the agency that oversees both the FDA and CDC, serious adverse events are probably more likely to be reported than minor ones, especially when they occur soon after vaccination, even if they may be coincidental and related to other causes. In short, those who experienced adverse events are more likely to report them than people who didn't. As the CDC notes in its 2021 V-safe protocols, quote, "Vaccinated people who choose to participate in V-safe might be different from those who decline. Therefore, rates of side effects and adverse events generated from V-safe might not be generalizable to the full population of vaccine recipients." End quote. Additionally, an adverse health event can include a number of factors as defined by the CDC. Quote, "Any health problem that happens after vaccination is considered an adverse event. An adverse event can be caused by the vaccine or can be caused by a coincidental event not related to the vaccine, such as an unrelated fever that happened following vaccination." End quote. Similarly, Because vSafe collects data over a long period of time, a number of health outcomes that may be unrelated to vaccination could also be included in the dataset. On page 14 of its 87-page report titled, vSafe Active Surveillance for COVID-19 Vaccine Safety, the CDC says, quote,